We all know that India has started one of the biggest COVID vaccine schedule from 16th of January 2021. Now from 1st of May, above 18 years, everybody is eligible to take the vaccine. Many people are asking the question, as soon as I take vaccine, will I be protected against corona immediately? Let me tell you the basic difference between a medicine and vaccine. Medicine is something which is given once if somebody has a disease to control the disease. For example, if somebody is suffering from typhoid, you give antibiotics for 10 days so that you can control the organism, you can kill the organism and control the disease. Whereas vaccine is something which is given prophylactic. What do you mean by prophylactic? You make sure that if you get infected with the organism, you don't get the disease when you take a vaccine. Therefore, when a vaccine is given, it does not start acting immediately. There is a time gap where the body has to produce enough resistant or antibodies to fight against the disease. Therefore, in case of COVID vaccine, 2 doses are given, and mainly people say, or the study has shown, that the amount of antibodies, protective antibodies in the body will be produced only after 28 days after the second dose or a month after the second dose. Therefore, if somebody takes a vaccine today, he is not protected against corona tomorrow. It takes a time, because as soon as a vaccine is given, the body should elicit an immune response against that particular vaccine, and it should produce enough antibodies to protect you. What are the different types of vaccine which are available in the world? There are 2 vaccines which are very popular and which is used in USA, that is RNA based vaccine. One is the Pfizer company's vaccine, the other vaccine is a Moderna company's vaccine. There are about 4 vector based vaccine which are available, and one of them is given in India, that is Covishield by Serum Institute of India. And there is one more vaccine called Sputnik vaccine, which is a Russian vaccine which will be made available in India from the first week of May. And there is a vaccine of a Johnson & Johnson company's vaccine, which also is a vector based vaccine, and only 1 dose of that vaccine is enough, and it is not available in India at this point of time. There is killed vaccine. 2 of the vaccines are produced by China company, but the only killed vaccine which has been there, many countries have bought it from India. It is an indigenous vaccine produced by a Bharat Biotech company. It is called as Covaxin. It's a inactivated killed vaccine. Now here the virus is killed, and a part of the virus which is called as antigen is introduced into the body so that the body elicits an immune response. In a vector vaccine, you take another virus. In this case, adenovirus is taken in case of Covishield vaccine. It does not cause any infection to humans. You take out the genome of that virus and insert another genome which will produce antibodies against coronavirus. That is the one which is given in India, the 2 doses of vaccine. And it has also been, a study recently released also shows that the Covaxin is protective against even the mutant strain of the organism which has come into existence of late, because of which we see a very high increase in number of corona cases. Whether it is a double mutant, or whether it is a Brazilian mutant, or the UK mutant, or the African mutant, the Covaxin as well as the Covishield is supposed to be protective against it. Many people ask, in spite of taking the vaccine, some people get infection. Why? The efficacy of the vaccine is only about 70 to 80%. So that means every 100 person who has taken vaccine, in spite of taking the 2 vaccines or the 2 doses of vaccine, he may get infection. 30% of the people may get infection. But please remember, those who get infection in spite of taking the vaccine won't get severe disease. They may not go into ventilators. They may not require extra care in the hospital. They may have mild cold, fever, and there only, in the house only, they can take care of themselves. That's why vaccine plays a very important role in fighting against this COVID disease. In 2020, when this disease was seen first, we did not have any means to protect ourselves except for physical distancing and mask. But in 2021, we have vaccine. Vaccine is the only way you can protect yourself against coronavirus. And please remember, if you have taken 1 dose of Covishield vaccine, The second dose also needs to be Covishield only. If you have taken Covaxin, the second dose also needs to be Covaxin only. You cannot mix the two vaccine and take the second dose. This, if it is out of stock, need not worry, because Covishield vaccine can be taken up to 12 weeks. The second dose can be taken up to 12 weeks. So you can wait and take your second vaccine. Protect yourself, protect your dear ones from corona. The only way you can protect is taking the vaccine. And before doing vaccination, I request all those young people who will be going after May 1st to take the vaccine dose to donate blood. Because if you take 2 doses of vaccine, up to 28 days after the second dose, you cannot donate blood. And you know, blood is very precious, and every day we require many units of blood in the hospital. So all the young generation who is going to take the vaccine, I request them to donate blood and then take the first dose of vaccine. Let us all fight against corona. It is not an individual battle. This battle has to be won only when we unitedly fight against it. There are many people in India who are thinking that the vaccination which is given in India, there is shortage of vaccine in India. Let me be very clear. Until yesterday, 14 crores 52 lakhs 71,186 doses of vaccine has been given. That is until 26th of April. And this is the highest by any country. India stands as number 1 in the number of doses of vaccine given. And we had reached 14 crore vaccine in just 99 days, whereas China had taken 114 days and America had taken 110 days to give the same vaccine. In terms of vaccination program, India is on the right path, and we have enough dose to be given to the entire population. Please remember, when India is getting vaccinated, it is the largest vaccination program in the world. The population of India is equal to the population of USA plus European countries plus the South American countries. If you put up all those population together, you get the Indian population. That is the amount of vaccine which has to be given in 2 doses. That is 136 crore people, means it should be 272 doses of vaccine which has to be given to the Indians. And it will take a long time because there is a gap between the first and the second dose. The Serum Institute of India is one of the largest vaccination producing company in the world, and they produce more than 6 crore vaccine per month. And every day, Covaxin, the Serum Institute, and the Sputnik, which is going to be released shortly after May 1st, and the Johnson & Johnson vaccine, all will come to the market. And we have to take the vaccine, and there won't be any shortage of vaccine, because India is geared up to vaccinate its entire population which is eligible for it.